Hey there, Patriots. I hope you guys are having a great day. I have two wonderful people with me. Hey, Dr. Laura, give us everybody a wave. And
Hey, how are
everybody
you?
knows Dr. Laura, who's our hero. And I want you to remember Pete Fowler. Hey, Pete, how are you?
I'm good. How are you all?
I'm glad to see you. This is so exciting. So we're doing a really cool update, everyone, super, super quick, because Pete was on with us a few weeks ago. I mean, when was it? 2 months, 3 months?
No,
I
we
would
have
say a couple years ago, I think.
No way.
2021.
Oh my goodness, had that long ago. I can't even believe that how much time has gone by. So, okay, so Pete has had treatments from Dr. Laura at prescribinglife.com. Check it out. If you aren't familiar with this, we are seeing I was actually there today and I see people, it's like Jesus time when people are getting healed right and left. It's so, so fun. Prescribinglife.com. So I want first Laura to tell what's been going on with Pete, and then Pete can tell what's going on. Go ahead.
right. So I can tell it from my side, but of course, Mr. Fowler experiences is every symptoms, and this is something that we believe at Prescribing Life is that every patient is special, and even if we have a diagnosis, it doesn't depend just in the diagnosis, but also in every symptom that the patient has, because everybody is different. So we can be talking about a radiculopathy, like in this case, or having some neuropathy or some kind of pain, but everybody experiences it in a different way. So
Right.
in the case of Mr. Fowler, his symptoms were mostly on his neck and also on his arm, and they were going all the way down to his arm and his hand. I will let him explain that. But what I'm really happy about his case, even if he says we started, oh, yes, 3 years ago, I think it's going to be our second anniversary. I don't see him too often because he lives away from Houston and he can come, whenever works allows him to do that. And even though we don't see each other too often, he's getting great results, and his medication, the one that he was previously taking for pain management, is almost all gone away, and he doesn't have to take it anymore. So that makes me very excited.
That's so, so exciting. And that was that same thing that happened with my mom, because she was on 3 opioids a day. And so now she doesn't even take aspirin. It's really amazing. So this is basically, can you tell everyone basically what neural therapy is, Laura?
Yes, of course. So neural therapy, like the name says it, is we're working with the nervous system, basically, right? So what we want to do is to heal or to repair areas of your nervous system. And if we remember, our nervous system is composed by our brain and then all the nerves that are part of that, including the spinal cord, of course, which is the most important. And then what happens is that every time our nervous system is sending or receiving information from any different area of our body, organs, or any muscle, extremity, etc., that can cause different signals, and that includes pain. When it becomes chronic, like in many cases, right, it means that there is an area that hasn't been properly healed. So what neural therapy does is to, first of all, diminish inflammation. It also, that is present in every kind of chronic disease. And then it opens up blood vessels, which is going to increase the circulation. So the amount of oxygen that we're receiving into specific tissues, and that's huge because it's improving our environment, our tissues. So that allows us to heal faster. And the third part, and this is why it's called neural therapy, is because we are working directly, sending signals to the nervous system in order for it to function properly again. So
Yes.
with that means that we're sending a signal so the pain, in this case, for example, can stop.
Yes. And that's what doesn't happen in the regular medical field. They really leave the nerves, from what I've seen, alone. It doesn't even come into play. And it affects really everything that we experience. If we have a medical issue, there's some nerve involved. That's what I'm learning. So yes, Pete, thank you so much for coming on to tell your story. So tell us where you were 2 years ago, and tell us where you are now.
Sure. So February of 2021, we had a big snowstorm here that I think you guys had really bad there as well. And that provided me a little bit of time to check more into some text I had from a friend in Guatemala who's been through the same kind of treatment in Guatemala. Up till then, I didn't think we had the same issues because he had like a curvature of the spine, and I was like, well, I don't have that, and I had other issues.
Yeah.
But as I talked to him, what he was describing the effects of, we had the same of. So I started to perk up, and I was actually scheduled for spinal surgery of 2 sides on my spine on the right and 2 sides of my spine on the left, which would have been I forget what you call them, but like C1 and C2 and C6 and C7. I don't know if I'm getting that right.
Right. Yes.
But I had, the way to describe it, I felt like a spear or an arrow was shoving through my back, and I had hot spots or knots, and off of that, pain was radiating across my top shoulder blades and then around my whole arm. And my whole right arm I had issues with for 6, 9 months or a year, and the pain in different areas had different things going on, that like 5 or 6 different kinds of things. And so we were praying about, is there any other option other than the surgery? Because when I went in for my kind of pre-surgery prep, they were telling me some things I never heard that they had never said in the years previously. That could be side effects, or they could be 3 or 4 surgeries of the same, because it only would last like 10 years maybe, due to parts they would put in your spine. So we started to get more proactive on what other options there were. So when I actually went down to, we talked to Dr. Laura in an evening in February. And I think within 2 or 3 weeks, we were down there, a month tops. But on March 8th of 2021 was my first appointment. Well, that was the same date I was scheduled for surgery. Since then, because I'm out of state, she bulked up on me, my appointments. We went down for 2 weeks. And since then, I've either taken 3 or 4 days at a time. I think the first 2 years, I went 4 visits from when we live in Oklahoma, 4 visits. Last year, I think we did 2 or 3, and I've had 1. So 1 visit this year. And so total visits in office, I think I'm at 36. And really the improvements that I've seen from Dr. Laura have almost exactly mirrored what she chatted with my wife and I about via computer before we ever met her and before we ever went down to Houston. So it's been, and my improvement has been probably 90% plus. The physical feelings I have mainly are now in my right fingertips, 3 or 4 of them, depending on the day. And even since my appointment 2 weeks ago, I always call it, it's like a receding, like water receding, or a calming effect from what it was to what it kind of now settles at. So
no more the arrow. You don't have the arrow feeling anymore.
Correct. That's long gone. Even 2 years ago, that part was clearing up.
Right. And no more cutting through the flesh and the nerves.
Right. Yeah.
Yes.
Because we need to have less cutting, not more. Right, Laura?
Right. Right.
Absolutely. And actually, well, so neural therapy, just a little quick thing, it started in Germany, and in Germany it's called the bloodless knife because it's supposed to not take us through surgery. And I just found your first visit, Mr. Fowler, and your chief complaint here, what you wrote was spinal degeneration and inflammation with spurs causing pinched nerves, which radiate extreme tingling, shocks, and pain from my shoulder blade down right to my arm.
Right.
Fingers feel like they're on fire. Scheduled for surgery, looking for options. So, yes.
Yeah, that it's been so long that it's hard to sometimes remember, but what you just said, I couldn't have repeated, but that encapsulates how it was. And the other thing I would say is, Dr. Laura mentioned my medication. So I was on 3 pills a day, 1 morning, 1 afternoon, and 1 night, full pills. And I can't remember if they're 100 milligram or how much, but she scaled me back along the process. And right now, after my last visit, we just went to a quarter of 1 pill all day. So 3 full pills down
like
to 1/4 of 1 pill.
Yeah.
So it's been, the improvement has been vast. So
that is so wonderful. It makes me so happy to be a part of what Laura is doing, because, you know, my piece and the Great Awakening is to share the good news about the truth about we're going into these beautiful days. And a big part of that is having our health. And it's hard to have, you know, peace on earth if you're in excruciating pain. And so this is so wonderful to have this. We're going to have so many of the true healing. And that's what, you know, what I've been going through, because I saw Pete there. I was getting a treatment because, you know, I'm getting treatment to help my breathing to increase and my heart to heal from the poison damage. And so, you know, it could be a variety of things. I've seen people, like today I saw someone with arthritis, you know, and she had pain all over her body. And so this is, it's going down, down, down. The pain's going down. And it's just very, very exciting, especially knowing that you don't have to look forward to more and more and more surgeries for the rest of your days. Right?
That's correct. Yeah.
Yeah. This is what we really want our doctors to truly, you know, help our bodies to heal. And that's really what the neural therapy does. And it's an exciting thing. So I'm so glad that you came on. Is there anything else you guys wanted to share before we go?
I'll add one thing, and it's really a personal thing is, and I say this I've not been prodded by Dr. Laura at all. So I mean this from the bottom of my heart. We've shared, I never feel rushed. She always gives me, and I know other patients, her full attention. In that regard, she's the best doctor I've ever had. We have a passion for missions. We share and we talk about that a little bit. I still try and respect the patient behind me, but I've never felt rushed. She's always gives me 100% of her undivided attention, and that's you don't always get that.
Right. Well, and I'll add one thing also, and that is, you know, with what I want someone who will help me to figure out what is wrong, instead of, you know, sometimes with others, you feel like you're a number and it's just, you know, but maybe my issue is a little different from another person's. And that's kind of what you said earlier, Laura, is that every person is unique. But that is a big blessing. That's a big gift to be able to do that, to be ready to help each person as a unique person, not just the same thing over and over and over. So yeah. Did you have anything else to share, Miss Laura?
Not really. I just want to say thank you to Mr. Fowler for those beautiful words. Thank you, Melissa, also. And we're looking forward to meet and to see whoever needs us. We're here for you all. So yes, we want to help people get better.
Yes, and you never know. Maybe you'll get to see Melly. You come to
it happens. It does happen.
Right, it happens.
Yes.
Yeah. So today I was there, and actually, the lady that I saw, she was sitting there, and she didn't know. Are you Melissa? I'm like, yeah, that's me. That's me. That was fun.
So excited.
You never know
when
I might be there. So, but main thing is we just don't want anyone to be in pain. It's too much. And you have your life back, right, Pete?
Yeah. 100%. I mean, still have a little bit of residual, but as far as what I'm able to do and the mobility and the pain going away, and I wasn't sleeping very much. So, I mean, because I had so much discomfort of trying to lie on one side, the other, my back or whatever. But yeah, the pain is gone for the vast majority. And so, yeah, it affects getting your life back greatly.
Right. Well, when you say that you can't really remember how bad it was, that's terrific. That's so exciting.